Armed guards at the gate of a hospital in India's northeast now have a new mission to protect the last doctor still standing after other doctors have contracted the coronavirus. The guards are there to protect him from relatives. One of the biggest challenges Dr Kumar Gaurav didn't expect was how to stop family of COVID-19 patients barging into wards to see their loved ones, often wearing just the flimsiest of masks for protection.
They just want to visit their patients. Even when our guards, our doctors are making them understand, they simply refuse. They just barge into our ICUs.
It wasn't supposed to be like this for Kumar. He moved back to Bakulpur, his hometown, for a quieter life with his family. He was working as a medical professor and junior consultant psychiatrist. But when other doctors tested positive for the virus and some refused to work, the responsibility fell on his shoulders. He's now the top official of one of just 4 COVID-19 hospitals selected to serve 100 million people. Dr Kumar worries about his constant exposure to the patients, but still feels compelled to keep working.
If I stand in front of a COVID positive patient for 2 minutes, and I suppose I see 20 patients, so I have exposure for 40 minutes in front of a COVID positive patient.
Kumar says that the healthcare system in Bakulpur is on the brink of collapse like the rest of Bihar state. Bihar has confirmed some 87,000 cases of infection, but that's relatively small compared to other states, and local officials believe that with a low rate of testing, the number may be worse. The state government's response to the outbreak has sparked litigation. A case set to go to India's Supreme Court this week cites a lack of hospital beds and unsanitary quarantine centres and argues the federal government needs to step in. Spokesman for India's federal government and the Bihar government didn't respond to detailed requests for comment. An exhausted Dr Kumar promises junior doctors in one meeting that he will try to convince the government that more resources are needed. He later admits that will be a difficult task. And in the end, he has to make daily compromises.
And sometimes when they understand that their relatives are not going to make it, it's a desperate measure by them to see their relatives, to say goodbye, to see their patient's face last time.
As infections slow in many other countries, India is still reporting more than 50,000 cases per day.